I have heard personally that people come in and they're like, oh yeah, my doctor said it's because I'm estrogen dominant. And that's why I'm getting these lesions. Um, so walk me through what's up? What's going on there?
This is something that grinds my gears a little bit. And I recently
We
got,
could tell by the look on your
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
Hello, everyone, and welcome back to the Advanced Women's Health Podcast. I am here today with Dr. Dasha, and we're diving into skin yet again, a topic that she loves and I love to pick her brain on, so it works well for both of us. So, all right, and today we're going to dive into HS, so Hidradenitis Suppurativa, right? I'm saying
yep,
that right?
Hidradenitis Suppurativa.
Exactly. Hidradenitis Suppurativa. There we go. We all internally just call it HS, and it is a condition that really does go overlooked and undiagnosed often. And if you Google it, if you're like, this topic is not something I've ever heard of, and you Google it, you're going to see some really severe presentations of a condition, and it is really a spectrum. So even if you haven't been diagnosed with this condition, but you have PCOS or now PMOS, right? PMOS, as I'm calling it. If you have insulin resistance, if you've ever had boils, etc., then all of these are things that could indicate that you need to know more about this condition. So I will let you take it away.
Totally. So let's break down what HS is in general. It's this chronic inflammatory disease of the hair follicle. You can get it in your armpits, in the groin area, under your breasts, and buttocks. And there are different stages to this, right? Some people present with just like a single boil or multiple boils. But when it starts to get worse, and depending on the progression of it, we can rate them in what's called Hurley stages. And there's 3 Hurley stages. First one, there's a single or a few little boils, but there's no sinus tracts. And sinus tracts are basically these little tunnels that form and they can coalesce or come together. Hurley stage 2 is when there's one or more widespread recurrent abscesses with those tracts. Okay, sometimes you get scarring. And then in the Hurley stage 3, that's when it gets more severe. We get these multiple interconnected tracts and abscesses. So this condition is very painful. And it can impact people a lot in their lives, right? It impacts self-esteem, mental health. It impacts whether they exercise or not, because sometimes with movements that can bother it. So these are big and painful and something really important that we need to talk about.
So let's talk about the distribution of HS, because I think that's one of the things that I find causes a lot of misdiagnosis and kind of confusion, is because where they tend to be located. So walk me through that.
Yeah, so as I mentioned, most commonly I see these in the armpit. And sometimes, like I said, people will often think, oh, maybe it's like a little ingrown hair or a pimple that keeps coming back. In the groin as well, it's commonly misdiagnosed as an ingrown hair. And then under the breast folds and on the buttock area, it's a little bit more obvious that it could be HS. But with any of my patients with acne, with PCOS, PMOS that come in and then they say, oh, I have these boils that come in on these other areas, or I have these pimples. Would you mind taking a look at them? And you'll see it's a little bit more raised, kind of like that classic boil appearance. Sometimes they have pus, sometimes they don't. So that typical distribution is something that happens. And again, with HS, you'll notice sometimes when it gets a little bit untreated, few of those boils come up. And again, they're just very painful and they sometimes rupture as well. And then scarring is a huge thing as well that we need to discuss, because if it goes untreated, again, you have these huge lesions that coalesce and scar. And again, they can be quite disfiguring.
And the thing I think is really important is, yes, the ones in around your buttocks and under your breasts are more obvious, but the number of times I hear people be like, well, it's just where I shave.
Yeah.
And so they think it is lesions from shaving. And so they don't even mention it to a healthcare provider. And I'm like, oh, no. Like, these are really key pieces that we need to be able to understand, because to your point, the scarring and the nature of the tissue change can get really severe if untreated. And so much comes up with confidence and all these types of things that I don't think we often talk about, but have huge impacts.
Exactly. So a couple things to think about in that regard. If you are someone that does get these kinds of boils or lesions, you have to ask yourselves, is this something that's been chronic, right? So occurring for more than 3 months and reoccurring. Like, do you get the same boil in the same spot? Do you get these in these classic locations like armpits, groin area, under the breast, buttock? Is it happening on both sides? So when people come into the clinic, and again, I do focus a lot on skin, so I'm lucky because these things do come up a little bit more. So I ask people, have you had a boil like this before? Do you have more than one now? We screen for these other areas, whether it's in your armpit, under the breast, buttocks. Do you have a family history of that? And we also have to remember that this condition, it does have other comorbidities. So PCOS, PMOS, as we discussed, metabolic disorders, even certain lifestyle things can make this condition worse. So always asking about that is going to be important as well.
So let's get into that piece, because there is so much of this condition that falls within the pillars of what we treat and understand in advanced women's health. So walk me through what is known about HS, because it's come a fair ways since I first started practice, but there was an HS clinic at Women's College Hospital in Toronto where I was practicing, and even they were still doing research and trying to pull things apart and sending patients my way to be like, there's a whole lot of stuff that can be done, but it's in your world and you need to figure it out. So since then, we have a lot deeper understanding. It's not just hormones and, you know what I mean, and diabetes, which is what they were looking at the time. So walk me through what we know.
Totally. So at its core, HS is an immune system problem, right? So similar to our other inflammatory diseases, it has these same overactive immune cells. And another important thing to mention, it is not caused by poor hygiene or an infection. Yes, there's a bacterial component present, but it's not caused by that. And what else we know is that there is a huge genetic component. There is also a big, like I mentioned, immune system component and metabolic component. So insulin plays a huge role in these. And we see that people with HS, if they tend to follow that standard American diet or are eating a lot of high insulin demand foods, and people that come in with HS, they will often have food triggers. We see that's really interconnected there. So going down to those pathways of what actually causes the inflammation is what can make HS worse in that regard. So again, at its core, it's this immune system dysregulation of that hair follicle, right? And if we boil it down into its most simplicity, we have this fire underneath that occurs, right? And it's affecting the hair follicle. That hair follicle gets blocked. You get this buildup of pressure, and then you get this bursting, right? And with this inflammation that occurs, you can see that it just does damage to that whole area, especially if what's going on underneath that fire doesn't get resolved, right? So again, we get these tunnels that are forming and other things that happen, right? So if we don't address that immune system component at its core, then we're just going to continue getting worse disease progression and inflammation.
And what within that inflammatory kind of complex that's occurring, what do we know about the triggers for that? Because you're talking about like stoking the fire and the boiling. What are some of those specific food triggers? Because you mentioned food, but what are some of the other triggers that we see in the research?
Totally. A big one with food actually is things like, and I hate to say this, but all bakery products. So that's what they've seen in the research. So like pizzas, bread, cakes, things like that. Vinegar, black tea, soy sauces.
Vinegar.
Yeah. Honestly, I don't know what's
History?
the proper vinegar is a big one.
Well, because if you're talking about soy sauce, you're talking about vinegar. What did you say was the other one there?
I was going to say beer, wines, fermented cheeses, mushrooms.
Histamine.
Yeah, histamine. And yeast is a big one as well.
Yeah, it's all history and stuff.
Exactly.
That's so interesting because you don't look at HS and think like this is mast cell dysregulation. Because we just went on a doctor aside. Welcome to Advanced What's Up. But when we're talking about the immune system, just as a reminder for people, there's a couple different tiers, right? So there's what we call our innate immune response. And so that is when the body says, I don't know when I'm fighting something. And so its mechanism of action is just blow stuff up. And so we can get allergies, we can get changes in something called a neutrophil, etc. But we just get this immediate, I just need to blow up and damage things response. Then there's another tier called our adaptive immune response. It's our memory. It's associated with autoimmunity. We can remember like cells, not like cells, etc. And the last time I checked on the immune axis, we looked at a lot more of the neutrophils, and we looked at a lot more of the autoimmune potential in this condition in terms of how inflammation is affected. But if you just list a whole list of foods that are all mast cell regulating, it makes me wonder if there is a bigger component to that. Have you seen quercetin work?
Sometimes antihistamines can help, but I haven't seen them be the main thing. But also that's just not the first thing I reach for in this condition. Yeah. But if we're going back to the key immune system players here, it's TNF alpha and IL-17 that drive this condition.
So it's so interesting that histamine foods are the trigger when it's not necessarily a mast cell driven disorder. That's so interesting.
Yeah. I think this condition does, and again, we're seeing so many things pop up where histamine is such a big component to it, right? Yeah. So I think it just needs more research in that area.
Yeah, that's really fascinating. So do you give low insulin demand, low histamine approach?
Low insulin demand for sure. I don't necessarily go all low histamine, but I will tell people to avoid those types of foods and definitely avoiding standard American diet, of course, and getting people to eat more vegetables, fresh fruits, getting people to have a little bit more of white meats rather than red meats. I think that's been present in the research as well. And a big component with it is most patients that I've seen with HS also have some underlying metabolic dysfunction. So managing
I've never seen it without. I don't have one single case. Yeah.
Yeah. So managing that is so important because when you focus on that, people tend to be able to manage this condition very well.
Mm-hmm. And I think it's such an important part of the conversation because not every person who has a metabolic disorder is overweight. Mm-hmm. And so, yes, if you are overweight and you have boils, it is frequent that this will be even more overlooked because they'll look at it as a bacterial kind of warm, moist areas, immune system dysfunction, a sign of a symptom of being overweight, unfortunately. But you also, even if you are lean and present with HS, you can have very high levels of insulin on postprandial labs. So meaning after you drink the drink, you can have a lot of blood sugar dysregulation after you consume food. And so those are key pieces because I have patients that come in and they're like, oh no, I have HS, but I have no dysfunction with my blood sugar. And I'm like, no. Unless you've been actively working on it, and that's been a goal of yours, I've not ever seen someone have a perfect blood sugar response with this condition.
Totally. And you know what? That's why the 2-hour insulin glucose challenge is so important to you, because it's not always about what things are like at fasting, right? Because it is helpful to see like, yeah, fasting insulin and glucose are normal. It's a good screening tool, right? But oftentimes we'll see with the more lean type patients with HS or with PCOS, PMOS, but you see this hyper responsiveness with their insulin, and that is what causes that inflammation, right? Because it's continuing to upregulate that pathway. So if we don't address that and acknowledge how big of a component that is, it's going to be hard to manage in this other subset of populations. Because like I said, if you just say, yeah, your fasting is all normal, you can eat all of the candy and higher insulin demand foods that you want, which no one, again, should be doing, they're not going to manage their condition well, and they're going to have to be on these treatments that just help settle the fire, right, more often, right? But we want to have long-term management and reduce reoccurrence.
Yeah. So let's get into that. So what are the treatment pathways? So one of them we've talked about is reducing the fire, and then there's reducing the recurrence, but then there's also that pathway of like, there's acute and chronic management. So walk me through how you think about the management of HS.
Totally. So we can kind of break it up into components of, like, we would definitely treat male and female a little bit differently, especially if there's these cyclic recurrences with the cycle. Then we would focus more on reducing androgens. So if we're thinking about it from like a naturopathic perspective, that would be some of our herbs and supplements that help reduce androgens. If we're thinking about it from more of a farm perspective, that could be something like spironolactone or birth control. So that would be, again, dependent on the patient's goals.
You said something that's really important that we didn't get into a lot, which is how it flares with the menstrual cycle in women. So what are some of those cyclical changes that you see that are important to highlight?
Totally. So cyclical changes, again, if in that luteal phase or if you're on your period, your HS gets worse, that is also showing us that it is getting worse with that hormonal component, right? So it's, if you're getting these recurrent boils kind of worse around that time of the month, could also flare with acne in other areas. So like the face, back, chest, that could be an indication that we have this cyclical flare going on.
And so when we think about female sex hormones and then androgens or male sex hormones throughout the course of this cycle, it's often not discussed how cyclical changes in conditions are actually a reflection of what's going on with male sex hormones. So I would love for you to break that down a little bit more, because I think I have heard personally that people come in and they're like, oh yeah, my doctor said it's because I'm estrogen dominant, and that's why I'm getting these lesions. So walk me through what's up, what's going on there.
This is something that grinds my gears a little bit, and I recently
We could tell by the look on your
So I recently did a presentation for the team, as you know, about acne, and I'll kind of extrapolate it to HS as well. But so many times people will come in and be like, oh, yep, I need estrogen clearance. I am estrogen dominant. That's why I'm getting this acne. No, that's not the case, because in the research, we actually see acne, and with HS in general, it is associated, like more flares are associated with lower estrogen, right? And that's like, if we extrapolate it to perimenopause, I know I'm going off on a tangent, just bear with me. But if we
give her.
extrapolate it
It's an
to
important tangent.
perimenopause, menopause, as we see estrogen go down, we see people get more adult acne as well, right?
Yeah.
And that's because it's unopposing the androgens. So we don't need to clear our estrogen or anything like that. We need to help balance things in a way where your sex hormones are doing what they're supposed to be doing instead of kind of all over the place, right? So I think that's something that's really important to memorize, acknowledge. because we have to look at it.
One doctors can memorize it too, like that.
Yes.
Because we live in a world where 50% of the world wants to cover their body in estrogen patches, and the other 50% still believe that estrogen's the devil. And neither one of those approaches is helpful. And I always say, like, our hormones are a dance, right? And so if you have this higher than normal level of either actual male sex hormones, DHEA or testosterone, or increased activity, because you can have increased activity of those hormones without them being high in your bloodstream. And this happens in HS. I've seen it many times. Your testosterone, your DHEA, they come back normal. Your doctor's like, you're fine. But you have all of these signs and symptoms of high male sex hormones because the activity is higher because of insulin and inflammation in that area. But if you have a higher activity there, then as soon as that estrogen drops below the theoretical line of androgens, you now present like you have high male sex hormones. So if you picture it, it's like is it a sine curve? When they're like up and down those 3 bell curves, right? Throughout the course of the month, we look at those as like the big shifts and changes in our hormones. And it's really critical that they have to dance together. And estrogen is very important for skin. It's very important for the immune system. And it just does get a really bad rap. But I'm
exactly. I'm glad it cleared it up too, because again, as a side note, I have patients that are in perimenopause or are so symptomatic. You know why they don't want to go on hormones? They don't want to gain weight. And I think that is the most ridiculous thing I've ever heard in my life.
Yeah.
Yes, that is a conversation for another podcast.
For another day.
But anyways, in terms of management, like when we're in a flare in general and for maintenance too, topically, doing something like a benzoyl peroxide, a higher concentration can be very helpful. As a wash, just leaving it on for a few minutes, letting it do its thing. Chlorhexidine is also very helpful as well because of the antimicrobial component. And both those things, and topical zinc washes can be helpful as well. So that's for everyone. How do you do that? Well, it's the zinc that's in anti-dandruff shampoos like Head and Shoulders.
Oh, okay.
Yeah. But zinc paste would be awesome as well. As we know, I love that for everything.
Yeah. No, because that's what I was wondering. I'm like, how would you do the wash, but it's in Head and Shoulders?
Exactly.
Oh, interesting. Okay.
Yeah. And then for when people are flared, one of the best management treatments for this is actually doxycycline because of its anti-inflammatory component and a little bit of the antimicrobial. And we do know that we can prescribe lower dosages that are kind of like they don't affect the gut as much, just at lower dosages. So we don't want to necessarily be nuking people's guts in that regard. But yeah, that is something temporarily that can be very helpful as well to help reduce the inflammation and manage things. And then as an adjunct as well, vitamin D and high dose oral zinc can be super, super helpful to help reduce that inflammation as well and act as an immunomodulator.
Do we have any research at this point on any of those kind of TNF alpha biologics or anything like that you know of?
Yep, biologics can be a component of that. The thing is with biologics, they're very expensive and they're also like you have to do a lot of screening for the patient and you have to tend to do these other little things before you go on to the biologics. So those are typically reserved for very severe disease and with the right patient as well, because if there's like any other components where it doesn't necessarily make them a good candidate for it, we tend to not even consider the biologic piece.
Yeah. It's just, again, going down that kind of like, is this autoimmune pathway, which we do believe it is. The thing about autoimmunity that I think is really important that a lot of times I talk about, but patients don't get this full explanation, is there's only so many medications because there's only so many pathways. And it doesn't matter the name of your autoimmune condition, whether that is Hashimoto's thyroiditis or lupus or rheumatoid arthritis. There are so many similarities to what's happening And so that's the other piece with HS, right? Is understanding that the immune system is a huge driver and it is very involved in the dysfunction potential autoimmune piece. Your thyroid should be tested, right? Like an ANA, I often will run just to screen what's going on with other aspects of the immune system. And a lot of times it does come back positive because there's this general immune dysfunction. And we don't get inflammation just in a hair follicle. Yes, you can. But oftentimes we're getting inflammation affecting so many tissues that we just like, our immune system has just lost control. And so it's a really important thing to consider.
Exactly. And we know that autoimmune conditions go hand in hand a lot of the time, right? So, for example, if someone has IBD, they might have a higher risk of having like psoriatic arthritis or other autoimmune conditions. So, yeah, that's a huge component, and screening for everything is going to be important because with these conditions, there's lots of comorbidities that can occur. So making sure you're doing a good, thorough assessment and looking at all these things, because again, if we're treating the person as a whole, we're not only looking and seeing like, okay, you have boils, I'm just going to focus on this, but we want to see, hey, what's actually going on in your entire life and what can we do to make you feel good from a holistic perspective, right? And holistic doesn't have to, I feel like, again, on social media, it's such a buzzword that it almost sometimes gets a bad rap, but it's such a good, like at its core, it is such a good principle because again, we're looking at everything, right? Because we have the privilege of time in the space that we're in. We have the privilege to investigate all these other things. So why wouldn't we?
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
Let's walk through, while we're on this topic, what it actually looks like to go through a course of treatment. So when someone's coming in, they're listening to this, they either know they have HS, they're thinking they might have HS, they want to get investigated. Walk me through that thought process. What are you looking at? What's happening in that first, second, third visit? Like, how are you prioritizing things so that people can get a sense?
Totally. So again, doing a full assessment is going to be important here, like diagnosing what stage they're in. So we talked about those early stages earlier, seeing what lesion count is like, if there's pain. So depending on that, if it's quite severe and there's active disease happening, we definitely, I definitely help put out that fire first. And I say, okay, we are going to get this under control first. And then we are going to implement these other things so you can stay under control. And my goal is always to, like, if they're getting flares, let's say some of my patients will get flares every 2 weeks, every month, things like that. I don't want people to be getting a flare in 2 weeks, like every 2 weeks, because that doesn't sound like good control to me. So we talk about that. I provide patients with hope because there is a lot of really great research on things we can do to help manage disease and help keep people without flares or minimal flares, right? We look at other comorbidities. So if there's obesity, acne, smoking is a big component as well, PCOS, PMOS, diabetes. So all of those things, we talk about their lifestyle. Do they exercise, right? Because there is really great research with exercise and HS as well, showing that the more exercise that occurs, the better the condition gets. And a lot of times these patients won't exercise, number one, because it's painful. Number two, because they're self-conscious. They don't want to go to the gym and have people see these boils, right?
Well, they've also been told, oh, it's like in the areas where you sweat. The number of times I'm talking to patients about exercise and they're like, well, no, I was told that like sweating was part of the problem. I'm like, No.
Yeah.
There's so much misunderstanding out there and like miscommunication. It's wild, to be honest.
Yeah. So it's really tough in that regard. But yeah, just providing people with hope and getting rid of this misinformation that they've been fed, right? And I usually talk about all the treatment options in terms of what direction we could go. Some people have a preference for a more like, and again, lifestyle and diet and supplemental should be something for ongoing management. Some people will opt to just do that. Other people will opt to go more of a pharmaceutical route, especially if they have more severe disease and it just nothing has been seen to work. So I find that when those worlds both kind of come together, it can give us a really lovely treatment. And I usually give them a plan kind of similar to what I do with eczema, where I say, okay, this is what we're going to do in a flare, and this is what we're going to do for maintenance. Yeah. And that is usually kind of that outline there. And then we follow up after we initiate treatment, seeing, okay, if they were in a flare before, did we manage that flare? Yes, great. We move on to continuing to do the things to help maintain them not having a flare. If they are still in a flare, maybe we add something else. Maybe we change some dosages of certain things. But either way, biggest things, assessment, providing people with hope, setting solid lifestyle modifications, and then giving them an action plan so they know what to do. Because I find that when people have a plan and they know what's going on and why things are happening, just have so much power over that condition, right? It doesn't feel like it's controlling them.
Yeah. So it sounds like to me we've got food insulin demand principles, customizing diet to what we know from an insulin resistance perspective is coming in. We've got some anti-inflammatories in the mix topically, and then also working within those anti-inflammatories that we have pharmaceutically. When we get into people who have that really severe tunneling, they have a lot of that tissue change and that deformation. We're talking a lot about the work to prevent that from happening and to try and get flares under control. But you and I have talked about this. We've seen some really severe presentations of this condition. So what are you doing at that point? Like, obviously you have to address all the secondary infections within those tunnels. Like, there's a lot of work to do there. But is there anything that we need to think about or do differently to support that category of people?
Oh, that's really tough, because when people get to that point where it is so severe, again, those principles are still very similar in terms of what we want to do to help manage. But if they have a boil that's just not going away, or a few boils that aren't going away, we have options of doing like steroid injections so that can reduce the inflammation quite quickly. And again, with people with severe disease, biologics is an option too. And then sometimes in severe cases, there will be surgery. That will be an option as well to help manage some of that, because the scarring can get pretty intense. The tunneling can get really intense. And again, it can be so painful.
Yeah. And I wanted to bring that up because I have many patients who've had to get surgery, right, to reduce the pain, the tunneling, the constant ongoing infections, like the inflammation's just perpetuating the inflammation. But just because you remove a tissue doesn't mean something's not going to return, especially when we have these immunological conditions. And so I have patients who've went and had surgery, and then within months, they're getting these lesions pop up again. And they're like, I was told this wasn't going to happen. Or they're getting lesions in a different area and they were warned that's still an ongoing problem. So unfortunately, we can't escape the foundations. But at the same time, isn't it great that you can have power, that those foundations can work? Because you and I have both seen this condition be brought under control in a really powerful way, using those fundamental principles of inflammation, understanding androgens and the cycle in women, and then also understanding that metabolic piece.
Yeah, exactly. And again, when we're approaching this condition, again, the immune system, if we're looking to what is causing the inflammation, Because again, we can look and see, oh yeah, we're just going to do antibiotics to reduce the inflammation or this to reduce the inflammation. But what's causing the inflammation, right? It's a dysregulated immune system and that metabolic piece as well. So that's what we have to target. And just reducing inflammation for the sake of reducing inflammation isn't going to result in long-term disease management. Long-term disease management results from us looking at things and saying, hey, this is what's actually going on. This is what I'm going to target, right? And that's the immune system, that metabolic component.
Have you seen, I haven't seen too many viral triggers. Because when we talk about like what's underlying it, obviously just having insulin resistance is very inflammatory. And so we're working through that piece. But then have you seen viral triggers? I've seen bacterial triggers, but from like a gut health perspective, because we always go back to the gut, right?
Yeah. I have not seen many viral triggers in this regard. Again, people, I think if I'm like extrapolating what I've seen with other conditions, they can have this little like a viral infection that kind of tips the immune system in a certain way, leading to that over responsiveness. So I think that's what I've seen and I can imagine, but I haven't seen like, yes, person gets X virus and then develops this condition.
Yeah, which we've seen with so many autoimmune conditions, especially in the last few years. So no, I was just thinking that because I'm like, I've never treated it from a viral perspective. It's always, to me, when I'm looking at those underlying pieces, I'm looking at autophagy and like the dead cells and the gnarly cells. The garbage hasn't been taken out, that being a problem. I'm looking at the underlying insulin resistance, and then we get something called lipotoxicity, and we get necrosis of fat cells. That's very inflammatory, and that worsens this condition. And then we've seen a lot of dysbiosis, so dysregulated gut microbiome, even again, those secondary infections locally, but then also in the gut, we see that. But I've never treated it from a viral perspective. Yeah. Was there anything else you want people to know about HS? I hope this has really helped people to understand that there is a pathway. There's so much that can be done. There's so much that's within your control. And then, of course, we have all of those additional things we can add on to that. But is there any last kind of takeaways you want people to understand about what is a lot more common condition than people, I think, realize?
Yeah. I want people to know that there is hope managing this condition, even if it feels like nothing has worked in the past. I want people to know that they can exercise. No, that sweat isn't going to like make things worse in that regard. And it's actually going to
They're
make
not
things better.
estrogen dominant.
It's not estrogen dominance. No, not estrogen dominance. And I also want people to know, people that don't have HS, that HS is not contagious. So if you see a person at the gym or whatever with this kind of oil, maybe just, don't worry about it. It's not contagious in that regard. And there's hope, there's management, and I think that knowledge in this case is power.
Honestly, I like that you say that because it can be very deforming. It can be when it's in its severe stages, it can be a very alarming presentation to see. And that person's dealing with enough, right? They don't need to deal with your reactions to their condition. Yeah. And I also, for people who are experiencing this, just know that, again, you're not dirty. You're not causing any problems for anyone else, and like, you deserve to be helped, but you also deserve a healthcare team that understands what's going on and isn't going to shame you or lead you down the wrong pathway. Like, you need someone who really loves treating this condition and understands it, and Dasha's definitely your girl.
Totally. And one more thing, and then I'll let everyone go, but if you go see someone about HS and they just say, okay, just do this one thing, and they don't talk to you about anything else, that's a bit of a red flag. So just make sure that you're seeing someone that has a good understanding of what HS is and how to manage it when it's good and when it's bad. So that is, our thoughts.
Complex management. Like, I think that's the big thing that we're getting to here is, we talked about a lot of things. It can feel overwhelming, but in the right hands, you get to do 1, 2, 3, do 1, 2, 3, do 1, 2, 3. And that is so powerful in terms of just being led in the right direction. So thank you, Dr. Dasha, as always. And I really hope you guys loved this episode. If you know anyone with HS, please share it, because God knows we need to get this information out to more people. And we will talk to you next week.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.